person in the weapon, or an unknown trouble, or some kind of dispute. And so one of those things that our first responders have to do is go and make sure that the situation is appropriate for the attendance of an M.C.I.T. The first thing is our first responsibility is to keep it safe. We also have to look at whether or not there are criminal charges that are appropriate and whether the M.C.I.T. response is going to be an effective response. And so that work all takes place in first response. And M.C.I.T. is a very valuable resource, but it's a limited resource. And so we want to make sure that we use it appropriately. We want to make sure that we send those clinical nurses into a situation that has been rendered safe, first of all, and secondly, is appropriate for their attendance.
Is it possible in those circumstances, as you sort of described, that they could sort of wait in the wings until things are determined safe, and if they need to be called off for something else, they could do so?
Well, again, I'm sure when a call comes over and the M.C.I.T. team is out and deployed and they hear a call where they might be required, I'm sure that they're heading in that direction as well, but it's not the first one through the door. The first response, and that actually means something. We send police officers into that situation because in first response, quite often it's a very dangerous situation, and we have to make sure that we make it safe before we send either a nurse or a paramedic or any other emergency service provider into that responsibility. That's one of the things the police do, is basically make it safe. And so, and it's also, as I said, a limited resource. Mr. Sewell indicated in an ideal world, we'd have this at 24/7 in all parts of the city. And quite frankly, it's an effective response. I would utilize police resources to do that. The limited resource is those clinical nurses. And that's why we're very, very grateful today that Toronto East General Hospital has signed an MOU with us to provide 2 clinical nurses. That enables us to put teams out serving both 54 and 55 division, which is East York and the beaches area of the city. And that's a large population that is now going to receive the benefit of having that resource available. And we'll make sure that it's available and used as appropriately as we possibly can.
You just said sorry, I just have a really quick follow-up question. You said you thought that if the M.C.I.T. team heard something that they thought they could require the help, but is that the procedure that they go?
They're on air and they're on the radios, and if they're aware of a call where their services might be useful, then it's entirely appropriate that they would pay attention to that, get close to that, and be available to respond as quickly as possible.
So they could get close and wait for instruction.
Well, I'm sure that happens, but what does not happen is we don't send the M.C.I.T. team in the first instance. That's what Mr. Sewell has advocated for, and I hope he now understands that's not the appropriate first response. The appropriate first response is to send police officers in there to make sure it's safe, and when it's appropriate to use an M.C.I.T. team, we want them there and available as quickly and as effectively as possible.
We're a step closer to getting transit constables back on the system.
Yep.
Do you feel confident in their ability? Are they trained well enough to deal with people?
We had some concerns with the way in which special constables were utilizing the authorities that they had been given as special constables in the past. But there's been a tremendous amount of work done between ourselves and the Transit Commission. Mr. Byford and I, but our people have worked really collaboratively together to make sure that the authorities granted to special constables at the T.T.C. is appropriate to the job that they have to do. So what their duties have been now taken into consideration in determining what authorities. It's not just a wide open, you have all and unlimited authorities, but it's the authorities they require to do their job. And I have a great deal of confidence now in the collaborative relationship between ourselves and the T.T.C. that their special constables will now use the authorities granted to them in a very effective way. We also have an additional resource in that I've got about 80 police officers as part of our transit control unit. So we have police officers to do police work in the transit system, and we have transit enforcement officers to do their bylaw enforcement work and to work in partnership with us. And I think that can assure the public that special constable status now afforded to transit enforcement officers will be very appropriate to use.
You have no issue with power of arrest if they witness criminal activity?
No, and it's very well defined in the Memorandum of Understanding precisely what authorities that they are granted and when they are required to contact the police. And those matters were not clear before. It's been made clear, and it's been a lot of work to get here. And we've worked very well together to do that, and I'm very comfortable now that the relationship and the working partnership, the Memorandum of Understanding that's now in place between ourselves and the T.T.C. for the work that their special enforcement or their transit enforcement special constables will do in collaboration with my police officers will ensure that the transit system remains safe.
Chief Blair, what about mental health illness for the training for Toronto transit officers? Would you agree that they need training?
Well, I don't know whether you heard what Mr. Byford said, but he talked about all of the training that his officers, his transit enforcement officers will receive, which included training for dealing with persons who are emotionally disturbed.
Do they still need provincial approval for this? I just want to clarify.
No, actually, the Police Services Act gives the authority to the board to grant special constable status. But I think the innovation is that used to be given to this sort of blanket authority to have essentially all the authorities of the police officer. And the innovation in this is that we look at the duties of the transit enforcement officers, what authorities they require to perform those duties. And we've made sure that those are the authorities that are given, but there are reasonable limits on how those authorities might be used. And authorities they do not require, they're not granted.
Chief, as far as Doring is concerned, we heard earlier that police were going to wait until instructed by the board to actually track Doring. We know now.
No, I think that was, frankly, that was misstated.
Okay.
We've always maintained the ability to record those events.
Okay.
What happened is the definition of collision under some provincial standards was changed.
Right.
And that activity of opening a door of a stationary vehicle did not qualify for classification as a collision.
Right.
But it's still an event that we will report, we will investigate, and that we can collect data on and report publicly on it.
So is Doring going to be recorded and reported specifically, not just as a bicycle incident, as actual Doring?
Well, it can't be recorded as a collision because that standard has been changed, but it's still recorded in our information system, still investigated, and where an offense has been committed, we'll still enforce it.
So when did that start? Because
It never stopped. It never stopped. What stopped is us recording it as a collision under our accident records. We no longer were recording it under accident records, but it's still recorded under our information systems, and we're able to determine how many of those have taken place.
And is that going to be data that the public can access?
Yes, all of our data is accessible.
So,
Some of it that isn't accessible can usually be obtained.
so just to clarify, you're saying that Doring has always been recorded?
Yeah, we didn't stop recording those incidents. We stopped recording them as collisions.
You started off the meeting, Chief, with a moment of silence there for Constable Zivzik. Maybe talk a little bit about the importance of that.
Yeah, today was actually the day of John's funeral down in Thorold, Ontario, and with his family. And unfortunately, couldn't be there because we had our board meeting. But I think it was entirely appropriate. We lost an officer last week, and we lost him in tragic circumstances. And we had a memorial for him earlier this week. And today, the board took the opportunity to recognize that loss and pay its respects, particularly through this meeting. And of course, our thoughts and prayers are with his family today. Another difficult day for them is that they had the final funeral service and interment for John.
How's the investigation going, Chief?
The investigation is proceeding, and our people are very meticulous in these things, and our accident reconstructionist and forensic analysis of the vehicles involved is proceeding apace.
Chief, we heard in there from the business plan that there is a significant decrease. I think Mr. Finkel said it was raising alarm bells for him in public perception of their satisfaction with the service in general. Do you have any thoughts or concerns about that?
The actual data that we're speaking of is data that was collected almost 2 years ago. It's the early 2012 data, but we've seen fluctuations in levels of satisfaction reported in these surveys. And in 2011, we were at 97%. Community satisfaction, which is quite frankly very, very gratifying. That number did drop in 2012, and it's important that we keep an eye on that. And I think it's entirely appropriate that the board would be concerned. One of the issues that we recognize as being important is we want public support for the work we're doing out there. And when the public, and polls have some limited value, but I think there are some messages we can take from that. And when people are expressing some concern over aspects of service delivery, the level or the quality of the service, then certainly we always pay attention to that. We want to keep the people of Toronto safe, and we want to make sure that the service we provide meets their needs.
Chief, I have a question about some allegations of non-cooperation with the SIU. When you conduct an investigation into an incident involving the SIU, your findings go to the Police Services Board, and those reports have not been made public. Would you like to see those reports made public?
No, that is at the discretion of the board, and there are aspects of those reports which, quite frankly, deal with issues of personnel, which is not appropriate to be made public. But let me be really clear: the responsibilities that I have to do the Section 11 reviews is clearly defined in the Police Services Act, and who I report to is equally well defined in the Police Services Act. In every single case, those matters have been subject to administrative review. In every single case, we've looked at service and policy and the conduct of the members, and in every single case, without exception, I have reported to the authority, the oversight authority, that the statute says I'm supposed to, which is my Police Services Board. And Mr. Scott and the SIU have an investigative role, but they were not given a statutory oversight role. The board has been given that. And so, Mr. Scott, we cooperated fully in the conduct of his investigative function. I fulfilled my investigative and administrative function, and I reported to those who have been given responsibility for oversight, which is the board. That's exactly what the law requires, and we actually had that matter reviewed by the Attorney General and the Justice Lesage, and he very clearly articulated that's the way it's supposed to be done.
Are you concerned, though, that the public is not hearing that side because these reports are not being made public? They don't know exactly what you've done to address these issues.
Well, again, the public concern is addressed by my board. My board is given the statutory responsibility for oversight of the police service. And my accountability and the accountability of the police service is through that board. And so those reports are completed and they are submitted to the board exactly as statute requires. As well, the outcome of the SIU investigation is also made public, not its investigative report, but the outcome of this investigation and the outcome of our reviews is also a matter of public as record as well, because if there are disciplinary actions or changes to policies and procedures, we report them publicly.
Is it a priority for the Toronto Police to cooperate with the SIU?
Absolutely. We cooperate fully in the conduct of their investigations. We have a statutory responsibility, and I think it's important for public confidence. But it is not my intention to accede to an oversight authority that does not exist. I respond to my board. That's who the law says is supposed to receive those reports, and they do in every single case. And we sought clarification, as I said, from the Attorney General on this. And what the Attorney General and Justice Lesage told us is do it this way. My responsibility is to complete those administrative reviews and then to report to my board. And that's what I've done in every single case.
Thanks, Chief.
Okay? Thanks a lot.
Thank you.